Hello, and welcome to the World Real Supervision podcast. My name is Dr. Cynthia Lubin-Langtu, and I am one of the co-hosts of this podcast. We would like to thank APIC for funding this podcast and hope it will be helpful in amplifying the conversation around intercultural supervision for clinical psychology and other mental health professionals. Today, our guest on the podcast is Dr. Erin Alexander. Dr. Erin Alexander is a licensed clinical psychologist with over 15 years of clinical service, leadership experience, and continued professional development. Dr. Alexander has held positions as a therapist, adjunct professor, supervisor, trainer, consultant, and professional mentor. She currently has a thriving practice in downtown Chicago, where she works with a diverse group of individuals, couples, and families. In addition to her practice, Dr. Alexander is the Psychiatry and Psychology Program Director for the Illinois Department of Children and Family Services, and is an active member of both the American Psychological Association and the Illinois Psychological Association. This conversation highlights issues around intersectionality. We are really excited to share it with you. Thanks for tuning in. Hello, Dr. Alexander. So great to have you. I'm excited to be doing this interview podcast today. So I'll give you a moment to briefly introduce yourself, and then we're going to dig into the questions.
Sure. I'm very happy to be here, was very excited about this opportunity and looking forward to our conversation today. My name is Dr. Erin Alexander, and I am a psychologist here in Chicago, Illinois. Identify as an African-American woman, married, children. I'm a psychologist. I volunteer. I do lots of different things. So I'm sure I'll be able to tell you more about myself as the conversation unfolds. But those are my high level overview of who I am.
Yeah, the 5,000-foot view. Well, I look forward to getting into the trees with you. So Dr. Alexander, what has it been like for you to be a supervising psychologist, especially in the context of racism, equity, and social responsibility over the years? And what has changed since you first began your career?
It's been quite a journey, I'd say. I had my first role as a supervisor actually while I was still in graduate school. I was one of those people who went straight from undergrad into graduate school. So this meant I was in my early 20s when I had this leadership role, and I was also providing supervision. And so I've been in leadership roles and been in the capacity of a supervisor for a long time in my career. And I think my graduate experiences and my graduate training helped me begin to integrate culture and cultural competence and cultural humility. I think because I started supervision at such a young age and the people that I supervised were significantly older than I was, It was important for me to balance confidence in what I was bringing to the relationship, but also a level of humility and creating an open space for people to kind of explore what it means for them to be a clinician and how they show up in the space and the parts of their identity that are salient to their client and germane to the work. In the context of my first role as a supervisor, a lot of the times we talked about identity as it relates to people's experiences with addiction. So some of the people that I worked with had histories of addiction, and we would often talk about, what does that mean in the work? I had mostly female staff, and I had one male therapist, and talked to him about what does it mean for him to be a male therapist in this space and how to navigate and negotiate those differences. And so those early professional experiences, I think, gave me a good foundation to begin to more meaningfully integrate what I was learning in graduate school and how to have those really difficult conversations around race and ethnicity and sexuality and gender, and do it in a confident and competent manner, because those topics, and even social class, right? Those topics that tend to be stressful and difficult for people to engage. I feel like I got a good foundation in graduate school to start to have those conversations. How do you have those conversations? How do you invite people to reflect? I think one of the things that's changed over the years with all of those conversations, when I think about supervising someone now, 20 plus years into my career, they're entering into the conversation in a different space. When I was starting out, saying something like white privilege, saying something like racism, saying something like social, white supremacy, there were those were like really polarizing ideas to even enter into a conversation. And so now I find that graduate students and clinicians who are out here doing the work at least have some baseline understanding, if not a deeper level of study and familiarity with these concepts. And so you can jump in a different place, and I find that you can go a little bit farther. So that's something I appreciate that has changed over time.
Yeah, what do you think? I was actually going to ask, and you answered some of it about your own work, and I'll come back to that question, but what do you think that shift is about? What do you think is different for students, supervisees that you see now, that they're ready to jump in at a different level than perhaps when you started your career? What do you think that's about?
I think our environment has shifted, and there are more people, more places, more spaces where these conversations are occurring. So when I was starting this work, we would have graduate students come to school here in Chicago and had never really been around people of color, had never been around a gay person before, had never seen a trans person before. And so now I think people, the graduate students have, I think, more varied lived experiences. I think the graduate students are more diverse. There's more exposure. And even, the students who identify as, heterosexual, white, cisgender, Christian, are still in spaces where they're hearing and being confronted with and encouraged to think about these things earlier in life. And so people come in with a different foundation.
So that there's a different level of exposure that you're finding and a different foundation related to that. But it also takes doing the work, which you talked about. So I'd like to hear a little bit about the opportunities that you've had to do your own work around some of the things you mentioned, racism, identity. Can you give us some examples? And how has doing one's work, your work, changed the way that you work with your supervisees? And then rolled into all of that, how do you manage your own reactions during the supervisory process?
Yeah, that's a great question. When I think about my answer to that, I think about academic experiences, I think about professional experiences, and I think about personal experiences. And I would say that my personal experiences and my formative years really gave me a great foundation of awareness and education around the Black experience and comfort with talking about the Black experience and our history, racism, my identity, the experiences that I've had. So I was raised in a family where my parents were in college in the 60s, and so they were protests. And they had kind of an activist spirit about themselves. So when we were growing up, my mother made a decision to send us to schools that she's an educator. So she made a decision to send us to schools where she thought we would get a really good education. But unfortunately, because of where we live, that meant that she was sending us into predominantly white spaces, all of which did not want us there, right? And so I started to experience racism in grade school. I didn't have the language for it, but that's what it was. I later, now I have the language for what it was, but I had a parent who was there with me as a support to help us understand what was going on, but also she supplemented our education. So I learned about Black history from my mom and from my dad, in our family system. And so I think that set a stage for me as I, kind of went into this field of psychology to really start thinking about, well, how do I bring my experience as a Black woman into this work? What does it mean for me to be who I am as I navigate these spaces, as I'm understanding this theory and I'm reading this history of psychology and I'm talking about culture and diversity in these really academic ways, but I'm living this, as a person who constantly has to think about these salient parts of my identity. And so I feel like the work started early. And I think for myself, when I was in graduate school, the work was very different. And mostly I had conversations with the other students of color where we, on a regular basis, when we were in the class, felt like we were having a different conversation from our colleagues. Again, we're jumping into this dialogue about culture and race and ethnicity and cultural competence from a very different place.
Right.
And so it was important to be able to seek out peer supports, mentorship, and other experiences to help me continue to integrate what I was learning in class and make sense of it for myself as a woman of color. I started TAing, which helped me. So I started to TA a class that was an experiential diversity class, a really tough class at the Illinois school. We don't have time to go into all the details of it, but it was an experiential class. It was a little polarizing because people, again, weren't ready to have those conversations about race and racism and white supremacy and institutionalized racism. And that was what we were pushed to think about, but also think about how we participate in those systems. And so teaching that class or TAing that class helped me continue to further my development and integrating my understanding of, again, how I work in these systems, how I operate in these systems, and how I can simultaneously be oppressed in this space and have privilege in this other space. So like all of those, witnessing those conversations, facilitating the work for other people, being in relationship with mentors really helped me continue to do that work on an individual level. And I think that foundation has created a continued openness that, and no matter what phase I'm in my career, I'm ready to and understand the importance of thinking about myself as a cultural being in these spaces and trying to understand all of what that means. As again, I'm oppressed in this place, I have privilege in this place, and maybe, my privilege has gotten a little bit more expansive as I've matriculated through my career and I have certain titles and I have quote unquote power in certain spaces, but understanding what that means and the continued limitations of that because of the systems that I'm still inhabiting. So it's layered, it's a lot. But I think the thing that's helped me continue to do this work is surrounding myself with like-minded peers who are also continuing to do the work and grapple. And so we're not just the people coming out and saying, well, I'm the expert and I'm going to teach you about this. I'm going to help you be a better, more culturally competent clinician. We're also challenging ourselves to be better and continue to grow.
Right. Yeah. And what has that, thank you for sharing all of that and really highlighting the importance of peer support from the time you were a graduate student in classes to now. Can you talk a little bit more about like what all of that looks like with your supervisees over time? And you had many different levels of supervision, right? And so what does it look like, or what has it looked like over time to be who you are as a cultural being and be navigating intersecting identities with your supervisees?
So I think the foundation of that work for me has been establishing relationships with people and being transparent myself, being vulnerable myself, and helping a student or a trainee or a supervisee understand my journey and that I'm still on this journey too. I have been and continue to be on this journey, but establishing a relationship and creating a space in the supervisory relationship where the supervisee feels comfortable enough to open up and share and to discuss themselves as a cultural being and understand how it's relevant to the work that we're doing. And so sometimes I find myself modeling what I have done and what I continue to do and how I make sense of, if we're thinking specifically about a therapeutic relationship, what does it mean for me to be who I am or who my clients perceive me to be? And what does it mean for them to be who they are? And how do our identities kind of engage with one another in that space? And so with supervisees, creating a solid relationship, encouraging them to reflect on themselves as cultural beings very early on in the relationship, I have found goes a long way in helping them think about what it means to be more culturally competent and have more cultural humility. I love being in spaces with people where I can help them integrate theory and practice. And so now a lot of people are coming to the supervisory relationship. They've read the books, they've, done the talks and they've taken the classes and they have familiarity with it all, but now how do I do this, right? And so I like the opportunity to kind of step people through this process of showing up and operating from a place that's more competent and more humble in a cultural sense. And so it starts with, again, that relationship, reflecting on yourself, and then thinking about, so then how do we integrate this into our work with a client? What does this look like? How does it sound? Where's an opportunity? And sometimes people start with recognizing the opportunity, even if they're not ready to jump in yet. They say, oh, okay, well, here's a place where I could have asked this question, or we could have reflected on this thing. It's like, yeah, I mean, that's progress, right? And so then the next time they're ready. And so we may practice that a little bit, do some role play as they're continuing to conceptualize the case, for them to understand how culture should play a role in their conceptualization, but then also how they're engaging and intervening with the client.
So what I hear is that there's a recognition that you're asking students to step into the ring, if you will, and that there's a vulnerability, but you're asking that in the context of having built the kind of relationship where they could do that, and a mutuality of transparency, I hear, undergirding as well.
And we're not just thinking about the identity of the client, right? It's the identity of the therapist as well. You know, we need to be thinking about all of that. And then in some ways, the triad of the supervisor, the student, or the trainee, and the client. You know, what does that, all of that mean? And how does all of that impact the relationship?
Yeah, absolutely. That's really powerful. It's related to the next question that I have here. So having said all of that, right, what are some of the obstacles and barriers, thinking on multiple levels? You know, I think we're both systems people, individual, institutional, cultural, that you've encountered as a supervisor working with supervisees and training them to be more multiculturally competent. So what are some of the barriers, and what have you done?
Yeah, I'd say earlier in my career, there was a lack of institutional support. You know, there were institutional barriers imposed that we had to kind of fight against on a regular basis. So the experiential diversity class that I mentioned was a class that it made students uncomfortable, and they didn't like it. And so they knew which faculty members were also opposed to the class and the content of the class, and they'd go to those faculty members. And there was on a regular basis, some sort of attempt to end the class, to stop the class. And so what we did, you know, as a teaching team, between the teacher, the professors, the TAs, we were committed. We were committed, and we kept doing the work in the face of the silent and sometimes not so silent protests. We kept doing the work, and we had, over the years, more and more students who understood why it was important and continued to support the work. So it was, you know, what we did about it, we recognized that the resistance was there. We understood it for what it was. It was grist for the mill. We talked about that in the classroom, and we helped students understand how this is kind of symbolic of some of the things that we're talking about in this class. And so we used it. And so, you know, that would be, I guess, the best example I have of institutional barriers. But then you have the individual barriers of students who don't think they need to do the work. And that could include, you know, students of color who, you know, don't believe that they can have stereotypes or prejudices, and they don't need to do this work. You know, so it's, you know, how do you overcome that? You invite people to reflect, you know, but sometimes you have to meet people where they are, and sometimes they can go with you on the journey and grow and evolve, and sometimes you have to leave people where they are.
Yeah. And so along those lines, you know, in thinking about all this work that you've done, what are some of the big lessons that you've learned? And I heard a couple of them there. And what has worked and what hasn't, in thinking about the barriers, and thinking about systemic levels, and thinking about the trainees over the years that you've had, the supervisees that you have had over the years? What do you think has worked and what hasn't, in your view?
I mean, what doesn't work is arguing and debating and using force to try to get students to come along and do the work. You know, they have to ultimately be ready to do the work. And if they're not, we have to accept where they are, and note that, and, you know, and be thinking about how to bridge the gap, how to move them along. But recognizing that if you're teaching a class, you may have 12 different students who start in 12 different places and end in 12 different places. And so being able to really look at each student and understand, you know, where they are and respect where they are, and think about what it can take to get them to move to the next step individually, I think has helped move me away from any measure of frustration or being tied to a particular outcome. My job is to invite people to explore, to reflect, to engage. And some people are ready and they knock it out of the park, and other people are really still, if we think about, the motivational interviewing and in stages of change or readiness for change, they're still at pre-contemplation. They're not there yet. It's like, okay, that's where they are. I'd say I've learned a lot, but I'd say the big lesson that I want to highlight that I had to remind myself of, not this past June, but the May, June before, around the deaths of Ahmaud Arbery, George Floyd, Breonna Taylor, that period of time, is to remind myself this work is a marathon, it's not a sprint. And I've known that because I've been doing this work in various iterations, and it's been called different things over the years. And more people have joined us in the work, I think, in some meaningful ways and sometimes to exploit. But, the flurry of activity and almost whiplash, that a lot of us were feeling who had been doing this work, there was this pressure to do more and to get out there and to just do and go. And it was disorienting. And I had to remind myself, like, it's okay to continue at my pace and doing the work in the way that I've been doing the work. After all this activity dies down, those of us who've been doing the work will still need to be here doing the work. And so really thinking about what at this phase of my career, what the engagement looks like, what meaningful engagement looks like. And also, like, reminding myself, how do you really facilitate change? Doing a training for an hour or two is not facilitating change necessarily. It's introducing people to information. It's providing information. But the work is after that. It's before that. The work is a deeper level. And so, again, the lesson, the reminder that I have to come back to is this is a marathon, and the work takes some time and in meaningful engagement.
The work takes time and engagement, and you've been engaged for many, many years. And what I hear you saying is that in order to sustain yourself in that engagement, you've got to engage at your own pace.
Yes.
For you. That's such an important lesson. Such an important lesson. Thank you. All right, next, how have you been able to recognize and integrate the various social contexts and intersectionality issues when working with supervisees? We've already started talking about intersectional identities, and I love that triad example or idea that you brought up, and I'd love to hear more about that. Especially those who may not believe that they're directly impacted by systemic racism and issues of equity and social justice. So in general, what has been the most difficult challenge for you? And what is an example of where you have been successful in helping your supervisee grow in multicultural competence? So thinking about that intersectionality, thinking about the kinds and levels of reflection and engagement that you're asking of your supervisees and trainees over the years. Can you give us an example of something that was perhaps challenging that you moved through in your view successfully?
With a specific student?
Sure, and giving as much or little detail as makes sense for this time.
When I think about that question, I think about it in a general sense, and I'll see if I can land on a specific example as I talk about it.
Sure.
But I had a structure to my approach when I was working with graduate students in supervision. And so the structure was that they had to share certain information with me. They had to conceptualize their cases in a particular manner. And we did that on a consistent basis. And so the information they would share, so at the time, when I was an assistant training director at a psychiatric hospital, we were on the west side of Chicago, primarily Black patient population, mostly from the west side. When my students would come in and present a case and conceptualize a case, I made sure that they shared all parts of patient's identity. And so getting in the habit of thinking about and talking about, this is a 12-year-old African-American male who's questioning his sexuality. He lives on the west side of Chicago, but he commutes to the north side to go to school. And that kind of telling me the story of who that child is, I'm hearing gender, I'm hearing sexuality, I'm hearing social class, different things that they're trying to navigate. And they also share the diagnosis and the reason for hospitalization, but that's not the sole focus. There's a danger when you're in a psychiatric facility to be focused just on, this person has been diagnosed with depression and they came to the hospital because they were threatening suicide. That's a part of their story, but that's not who they are, right? And so what I think the thing that helped me be successful with moving students through really starting to think about and conceptualize cases differently is having a consistent frame where I'm inviting them to think about all these different aspects of their patient's identity. And I think as a year would progress, as I'm asking them questions, then I'd ask questions. What do you think it means for this young man to commute from the west side to the north side? What's their community like on the west side where they live? What are they telling you about that neighborhood? What are they telling you about the school that they're in? And how do they feel in those different spaces? Oh, this school's a Christian school. Does this person identify as Christian? What does that mean for them? So it's really getting in the habit of asking them questions and inviting them to be curious about these different aspects of a client's identity. And so when I think about it in a general sense, the success stories that I've had has been because I have that consistent frame and that consistent way of having students to reflect on cases and conceptualize cases, and they become accustomed to me asking them certain questions. They start shifting how they're thinking about cases, and they become more curious about different aspects of a client's identity. And then they'll start to ask, okay, well, if I'm intervening, what is it what question do I ask the client, or how do I have a conversation with them? I think some of my favorite moments would be when my students would get to the point where they were comfortable enough to say, well, how does it feel for you to work with me as a white woman? Because most of my students were white, predominantly female. And they didn't often end up having conversations about, their SOGI, their sexual orientation or their gender identity necessarily, but it was mostly race and ethnicity was what would be more salient for the clients that we worked with. So when I would see people get more comfortable with introducing that would be a great moment, because then you're setting a frame for the therapeutic relationship and giving that patient, that client, an opportunity to say, well, I'm not thinking about it, or this makes me very uncomfortable, or I don't think you understand me. And then for them to be able to tolerate that questioning and that discomfort and do something productive with it. Those would be the moments that I loved. And the students, when they could do that part of the therapeutic work, I think they would become much more confident in navigating these conversations in therapy.
Yeah, I really appreciate the frame that you set out, and how you allow them, it sounds like, to take ownership of that frame over time, and that's part of your assessment of the evolution of the supervisory relationship, but also of their relationship with their clients. Right? There are all these parallel processes that you're describing and attending to over time. Yeah, thank you. So how do you promote or teach culturally responsive interventions? And what has seemed to work for you supervisees? You allude to the frame that you're setting, but in terms of the actual interventions, how do you go about teaching and training?
So there's always a didactic component of a training program. And so again, when I was at the hospital, at Hartgrove Hospital, we spent a lot of time in different spaces where students were learning different intervention types. They would learn from us as the supervisors. They would learn from each other. We would have people come in and do guest lectures and that sort of thing. And so exposure was very important. But then on the other side of the exposure, it's inviting them in supervision to reflect on how do I integrate this understanding? How do I integrate this work into what I'm already doing here?
So didactic exposure coupled with the integration and the call for that self-reflection and integration in the supervisory setting. Yeah, wonderful. How do your students or supervisees translate their awareness and knowledge to action when it comes to providing culturally adaptive interventions? Can you think of examples of how they've done that in the different settings in which you've been?
Yeah, I think the translating it to action, it happens in those spaces in the therapeutic relationship. In supervision, I would talk to them about, what is your theoretical orientation? What are the different, culturally responsive intervention strategies you've learned? And before they do that with their clients, what does it look like? We brainstorm on what that looks like in the timing of certain interventions. We go from starting with the conceptualization to what might your intervention be? And how do you deliver that intervention? And what's the timing of the delivery of that particular intervention? And so it's using the supervisory relationship to brainstorm, to do some modeling, to do some role playing, and preparing for doing that. And I find that when students have an opportunity to practice with me, they may be anxious and a little uncomfortable in the beginning, but that becomes a safe space for them to do that practicing and be vulnerable and say, okay, I didn't quite deliver that the way I wanted to. Let me try that again. And then by the time we practice it enough, when the opportunity presents itself with a client, they're ready.
Right. So the practice isn't necessarily what they want in the moment, but you're finding that doing that in the setting, in the relationship that you've established allows them the springboard to actually do it in a different way, in a more practiced and competent way with their clients, and perhaps confident too, right? Because they've gotten all the kinks out of the way, perhaps. Yeah, thank you. Switching gears just a bit, as a clinician, teacher, supervisor, consultant, any other roles that you'd like to add professionally, how do you take care of yourself? We know that self-care is extremely important to prevent burnout. What do you do and what do you recommend for others? What supports do you have in place? What does it look like?
Well, so self-care is a moving target. It is something that I think I need different things at different times. I think because I am so busy and I have so many different things that I do, there are seasons where I have less time for self-care. And so and what it looks like when I have less time is very different, than what it looks like when I have a bigger chunks of time available. So for me, I recognize and accept that it's a moving target. I recognize and accept that I have to have a toolkit of activities that I can do, anything from 5 minutes to a couple hours to, days, weeks, a vacation. One of the things that I've really loved and integrated in the last year is this notion that, the book that I like that kind of introduced me to this is called Feel Better in 5. And it's a primary care physician who likes to do kind of more holistic work with his clients to help address their physical health and sometimes their mental health challenges. And what he talks about is that, you can give yourself quite a bit of relief in as little as 5 minutes. And so he talks about these things called health snacks. And so in these 3 main areas, these examples of little things you can do, these bite-sized bits of self-care in 5-minute intervals. And so he recommends you do 3 of them. So a total of 15 minutes, mind, body, heart, right? So mind is something like, deep breathing, stretching. You can even do HIIT exercises for 5 minutes.
That could be a full workout.
Yes. So, right. So that's body. I think I said that was mine. Mind could be something like, mindfulness and meditation, and heart is your connection to other people. And so that's been really helpful to me to remind me that even when I'm extremely busy, I can find 5 minutes to meditate, or find 5 minutes to listen to my favorite song and dance and enjoy music for a little while, because music does something for our spirit, So to not see it as has to be this big, complicated, I need a spa day sort of thing, although spa days are amazing. When you don't have time for a spa day, what can you do instead? I have a client who canceled. Oh gosh, okay, let me go for a walk. It's sunny outside. Let me just go sit on the park bench across the street and listen to music. So I try to be flexible in all the things that I consider self-care, but also think about the difference between resting and restorative practices, because sometimes the restorative practices for me need to be a little bit more active. So stillness and sleep is really important, having a healthy diet, but restorative practice for me, exercise is restorative, yoga is restorative. So making sure that I do those things too. So sleeping and moving and making sure I eat and drink healthy things.
Yeah, yeah, so important, right?
Yeah.
Like our very bodies, right, are the center of our care, and then moving from that space. I'm
One
gonna
of the things that I've been exposed to in the last year as well is, I think her name is Tricia Hersey. So the NAP ministry, I don't know if you've heard of her before.
tell me what you've heard.
Yeah. So yeah, that rest is a form of resistance, right? That, as people who do what we do, and especially as Black women, we need to sometimes stop, pull back, say no, step off to the sideline and get some rest, and not continue to be caught up in the systems that demand that we do more and more and more and take care of everyone else. And so I've always been someone who knows I need to get my sleep, and I love to get my sleep, but I also like that concept that no, right? No, I'm not going to do more, and I'm going to go rest instead.
Right, right.
I'm going to go sleep.
And rest
is resistance. Yes.
Right. Rest is resistance to the pressures that folks try to put on us. Particularly, I would imagine, in the roles that you're in, and the spaces that you take up, and are asked to take up sometimes as well. Yeah. I actually have two more questions, but I'm going to pivot just a little bit. So I hope that you pivot with me. Something that you said about being Black women and the rest is resistance made me think of Bell Hooks passing away last week. And I've just been both brokenhearted but elated to hear so much of the impact that her work has had on so many others, knowing how personally I took her work. And so I want to read a quote that spoke to me so deeply. And I just wondered if, in the spirit of this conversation around supervision, that you can reflect on it, or anything else related to Bell Hooks that you'd like to throw in there. So the quote is, it says, "Rarely, if ever, are any of us healed in isolation. Healing is an act of communion." And so much of our conversation has reminded me of that, and your talk of relationships and the grounding that has been. So can you say a little bit about what this means for you in terms of supervision, and any other words that you'd like to share?
If I can pivot a little bit, so it's when I think about that quote from Bell Hooks, it makes me think about how important and how life-giving my relationships outside of work have been, and that's what allows me to keep doing this work. That my girlfriends, from college, my girlfriends from high school, one of whom I talked to on the phone for an hour today. We were able to steal time in our busy lives to just connect, and talk about like fun things, but also talk about the hard things, and be there for each other. And I've also cultivated a great network of psychologists of color who are friends. And we can come to each other with, the trials and tribulations that we face as psychologists of color, and support each other. And sometimes you don't have to say much because they just get it. Right. And so that having those spaces outside of the work, they fuel me, they fortify me, they restore me, and are integral in me being able to continue to do the work. So that I love that quote. I need to make sure I write that down. And Bell Hooks, when you mentioned her name, I kind of felt a wave of emotion and a little bit of teariness because, and not to be hyperbolic, but she helped me get through graduate school, because she spoke to me as a Black woman in a way that my professors couldn't or wouldn't. None of what we were reading and talking about in the classroom could or would speak to my experience in that way. And so as busy as we were and as stressed out as we were, I found time to read and sit with Bell Hooks. And so she, came into my life in that phase of my life, and I will always remember and be and sit with gratitude and honor her for the woman that she was and what she did for so many of us, because there were a group of us who we would read her books and pass them around and talk about it and just share, right? And be in communication and communion with one another around her words, because they were so affirming, and they were so, again, life-giving. So she will always have a special place in my heart. And I encourage as many people as I can to read her work.
Yeah, agreed. Same. I could go on. Thank you
Yeah.
for sharing that connection and expanding that connection to that. Related to that, and you've shared a little bit about what I was going to ask you next, is what else keeps you on your journey? This is a lot, that we have taken on, particularly as Black women, right, in this field. What keeps you going in your journey? How do you continue to stay encouraged and hopeful despite setbacks, especially in light of, the last couple of years of COVID, watching Black bodies decimated on screen, racial disparities, all kinds of stuff is happening. What keeps you going?
The strength of my ancestors, the strength of the people who have come before us. It's interesting that, as things were unfolding, 2 years ago, for a lot of us, that wasn't new, but it was intense. It was intense and it was everywhere at the same time. And so being a psychologist, being a leader of another job that I hadn't really talked a whole lot about today is I have an administrative role for the state of Illinois, and I lead a team of psychologists. So being a leader in that space and being a psychologist, and then being a mentor to graduate students, and then being active in IPA and APA, every single one of those spaces needed me to show up and write a statement or say a thing, or, have a difficult dialogue or have a something. And, it was a lot. It was very intense. And so, what keeps me engaged in the work is like what got me through that moment was reflecting on the strength of the people who came before me. And no matter how hard this is for me right now, they suffered and struggled through much more. Yeah. And so, I found myself, I was looking for, Toni Morrison, because she writes about our history and our stories in a way that's very poignant. I was reading more and kind of retreating to spaces where I could sit with the strength and the lived experiences of our ancestors. And so that really fueled me and kept me going forward. And I think on another level, I think what's always with me is a desire to continue to fortify our community, the Black community specifically, to be a person who's a leader in the mental health field and is a model and an example for students who are coming into the field, Black students who want to be psychologists and want to work in this field, and showing them all the different things that they can do. But then also demystifying, mental health and demystifying therapy, and also inviting people to reflect on and be intentional about wellness, to be a voice to speak to all of that, and to use whatever platform I have at the time to speak to Black people about mental health, about wellness, about the benefits of therapy. I know we were taught this in graduate school. We're underrepresented in outpatient mental health and overrepresented in inpatient, mental health facilities. And so how do we engage in those supportive spaces before it gets too bad? So that's what keeps me going. It's just really wanting to do my part to strengthen and fortify us, and to also do my part to invite people into these spaces of healing. There are a lot of different spaces of healing that we have that we can go into, and they can be religious and spiritual spaces. They can be our familial spaces, but there can also be these spaces that we create as therapists that can be a healing space for people. And I just want to keep creating more and more of those spaces for Black folks. I have a diverse client population that I see here, and I love that, but the majority of the people that I see in my private practice are African-American or Black. And I like being here for them, because there aren't very many of us out here, and there are more and more of us who are seeking mental health services.
Thank you for that. So much there, but being grounded in the ancestors, and I can so deeply relate to that. I remember sitting on my rooftop the summer that George Floyd was murdered, Breonna Taylor was killed in her own home, on the tails of Mount Aubrey. And I remember sitting on my roof and just needing rest and resting. And I remember wondering, I wonder what my grandmothers would think, and both of them are gone in body, but with me in spirit. And I remember thinking they would be so grateful, right? That I have this space and time to rest. I felt like I was resting in resistance for them in the moments that they didn't have to rest, right? I really appreciate your sharing of your connection with your ancestors sustaining you. I can very much relate to that piece. And then the communion, which we talked about before, and you being a force in creating spaces for communion, particularly around wellness and mental health. In communities of folks that look like us is such an important piece. So thank you for all that you do.
Thank you. And there's a ripple effect, right? If if you can help heal a client and help give them a different toolkit, then that ripples out into their family system, to their friend network, to their workspaces. And I see that, you can work with one person, but you can affect a whole group of people around them.
Yeah, absolutely. Yeah, it's exciting, right? I always tell people, like, I love doing trauma work, not because I like to hear the traumas that people have experienced, but because I know that folks don't have to live this way. You don't have to live in fear, in captivity to your own stuff. You don't have to live that way. There's loads of help, and you can live with freedom and levity. And that's what excites me, is that I know that I can help, that there are others who can help, and I want to shout it from the rooftops, right? And it sounds like you're doing the same in your way, and I really appreciate that. My final question, and then anything else that you'd like to share. So thinking about this podcast, we're hoping to provide tools for folks to be able to think about intercultural supervision. What are you interested in learning more in this area? Or what do you think would be helpful trainings in our field around intercultural supervision?
I appreciate opportunities to engage with my colleagues who are in academia, because, you guys have your finger on the pulse of the latest research and, writings and reflections and models of intervention. Sometimes, those of us who are so I'm in private practice, and I have an administrative job with the state of Illinois. And I haven't been an adjunct professor for a while. And so I feel distant from the academic literature that you guys have access to on a regular basis. So I think something like that would just kind of be like, hey, this is the latest and the greatest, or hey, this is the latest thing that this is on my syllabus, right? I did a panel with a professor from, I think she's at the Chicago School, and she talked about a class that she's teaching. She talked about some of her books and her articles. Now, that's amazing. Can I audit your class? Can you send me your syllabus? And she did. She sent her syllabus, but it was great because she is teaching about a lot of things that I hadn't read yet. So I think, I know that's a broad question, but broad answer, but something that allows us who are out here in private practice to connect with, get the syllabus, audit a class, get your readings, that I think those things would be great.
Wonderful. So a bridge to what we're talking about now. What's the current research? What are we understanding? What are the new questions that we're asking? I love that. I love that. Yeah. Perhaps you'll work on that podcast in the future. The latest and the greatest. I like that as a title. Well, Dr. Alexander, is there anything else around intercultural supervision that you think, oh, I really would like folks to know this, think about this, hope towards this, aspire towards this, do this?
I think, for those of us who are post-licensure, to just look for spaces to keep doing the work, to look for spaces to keep challenging yourself to learn and grow. I think we have to be intentional about creating supportive spaces for newly licensed psychologists. I think our field sometimes does a disservice to newly licensed psychologists because we give them a lot of power and a lot of responsibility that they may not be ready for. And that can show up in their supervisory relationships, that they're not ready to be a supervisor, but because they have a license, they are a supervisor. And if they're not ready to do this kind of work that we've been talking about, then they can do damage or feel insecure, right, about their ability to be effective. So even with good intentions, they don't feel prepared. And then that shows up in different ways. So, finding spaces to continue to get the support and do the work of, because supervision is a skill. And just because we know how to do therapy and we pass the test, and we're licensed, doesn't mean we know how to be a supervisor. But we let people be a supervisor because they're licensed.
Right, right. And so more support as opposed to being punitive on the other end, creating spaces and structures for support and recognizing that as a field. Yeah, absolutely critical, so important. Well, Dr. Alexander, thank you so much. It has been an absolute pleasure getting to know you. I look forward to more connection and connecting in the future. I've learned so much in this last hour with you, and I know that the folks out there listening will as well. Thank you.
Thank you. Thank you for the opportunity.
Of course.